Good morning everyone. Today we'll discuss about purposes of nursing research. What are the purpose? Why we will do the nursing research? For what purpose? That we'll study today. Okay. Nursing research has a tremendous influence on current and future professional nursing practice. Nursing research is a tremendous, which plays a tremendous influence. It will influence not only current situation but also future professional nursing practice. Okay, so thus rendering it an essential component of educational process. So it is known as an essential component of educational process. So nursing research is known as an essential component. Nursing research is critical to the nursing profession and is necessary for continuing advancements that promote optimal nursing care. Is a critical to nursing profession. Nursing research is a critical to for nursing profession and also necessary for continuing advancements in the nursing will be continuing that promote optimal nursing care. Optimal nursing care will be promoted. Okay, first purpose. What is the purpose for nursing research? Why we want nursing research? Okay, identification, to examine phenomena about which little is known, to identify how it is coming, how it is defining, how comes everywhere in research, how, when, which, why. If the question comes, then the research will start. Okay, first we will identify the problem. Then description means description of phenomena, observe, count, describe and classifies. This is known as description. Example topic: stress and coping, pain management, health beliefs. On these topics we'll write a description about that topic. That is known as description. And exploration, exploring means we will investigate, explore the relationship, show to the world, explore to the world, not only within us but to the world. Investigate full nature of phenomenon. Example, explore the relationship between phenomena, to explain the relationship between any topic. And fourth one, explanation you all know, offer understand to underlying causes of phenomena. Explaining how can we understand, explaining that topic, and explain on how and why phenomena exist, how the phenomena exists, why the phenomena exists. That should be explained. Any topic we cannot read it, explanation should be needed. So explain. And fifth one, prediction. Fifth one is prediction and control. To make prediction and control phenomena, we should predict it can happen like this, maybe it will happen like this. Predicting, it may happen or it may not happen. If we do this, these results may occur, these results may not occur. That is predicting. And controlling you know no one example for prediction and control. Example, women above 45 years have risk for evidence of birth of Down syndrome than women at 25 years. Not evidence, incidence. See, example, there is a incidence that 45 years women have risk for birth of Down syndrome baby than women at 25 years. Why? Because 25 years is eligible age to give birth to the baby, but 45 years it is a age where menopause will start in some women's, where the hormones are not healthy enough compared to early ages like 25. Women are eligible from 18 years according to the authority or according to the socially, but according to the health wise, women approximately healthy to give birth is like now 20 to 25, and below 32 or 35, but not more than 45 years. No, the hormones will be not healthy, and women will not have much capacity also, and it is not supporting. Women's health will be not much supporting. Okay, there is an age between when we should give delivery, when we should not, when the hormones are healthy, when the hormones will become unhealthy, and that will be a different phase where menopause will be the primary stage for initiating menopause. Okay, and next one is prediction and control. You know what is the difference? No, predicting, it may come, down syndrome incidence is there, it may come or may not come, but there are chances that 45 years women have more chances of giving birth to down syndrome. And promote evidence means proof. What is the proof? That is known as evidence, that is based nursing practice. And seventh one, ensure credibility of nursing profession. We should ensure the credibility of nursing profession. And eighth one, provide accountability for nursing practice. Accountability should be provided. Document the cost effectiveness of nursing care. We should document each and everything. We should document. Okay, otherwise one or the other day it will be on our head only. Why you did not document? Why it was not done? What was happened? Everything will be questioned by us nurses. So documentation is very, very important in nursing. Okay, these are the purposes of nursing research. See, identification, description, exploration, explanation, then prediction and control, and evidence, credibility, accountability, and the last one is documentation is the most important. Okay, now we will go discuss about need for nursing research. The purpose of research is to discover answers to questions. What is the purpose? To discuss answer to the questions through the application of scientific procedure. There will be certain scientific procedures applicable, and for those applicable procedures we will be discovering answer to the questions. Okay, and basic research is necessary to generate new knowledge. And technologies to deal with major unresolved health problems. We need technology to deal with major unresolved, which are not solved, which are remain like that only. Most of the questions of health problems that will be resolved by technologies. Okay, and applied research is necessary to identify priority problems and to design and evaluate policies. Applied research, they are telling the types of research. First one, basic research necessary for generate new knowledge and technologies to deal with major unresolved. And next one is applied research is necessary to identify priority problems. Priority means what is the major problem, then moderate, then the least problem. According to the priorities, they will differentiate the problems and to design and evaluate policies and programs that deliver the greatest health benefits and making optimal use of available resources. We should make optimal use of available resources. And clinical nursing research designed to generate knowledge is generated and guide the nursing practice, improve the health and quality of life of nurses clients. Okay, first one is basic research is necessary, applied research is necessary, clinical nursing research. And during the past 2 or even 3 decades, means 20, before 20 or 30 years back, there has been rapid evolution of concepts. Rapid evolution means it will be change. Before how the world was, now the world is, that is the evolution. There was rapid change, means sudden change or fast change, evolution of concepts and research approaches. There was more evolution in the research concepts and approaches to support managerial aspects of health development, to development of health. And it provides nurses with an increasingly sound base of knowledge form which to practice. Sound base of knowledge, they have given more knowledge form to practice, especially for nurses. Okay, this is the need for, this is about need for nursing research. This is about need for nursing research. Now we will go with needs of research in nursing. Needs of research, why we need research in nursing. This is for nursing research, need for why we need nursing research, but why we need research in nursing, that we will talk. Okay, don't be confused. You can read the heading calmly and understand. Need for nursing research, this is totally nursing research, why we need. Okay, this is needs of research, why we need research in nursing. Okay, why we need research in nursing? Okay, to mold the attitudes and intellectual competence and technical skill. To mold means to improve. To mold means improve. They will have shapeless, we will give shape. Mold means shaping the nursing attitudes, intellectual competence and technical skills. We will mold all this. Okay, and next coming to the second point. Next coming to the second point. Second one, fill in the gaps in the knowledge and practice. If there is any gaps in the knowledge and practice, they are practicing, there will be some gaps because they don't know, they will leave, and that the gaps will be left like that only. So filling the gaps in the knowledge and practice, and fostering a commitment, accountability to client. We should give commitment to the nurses. Every nurses should be commitment. There should be commitment. I should do this, I should have this, I should involve this in my nursing practice. There should be accountability. Okay, and next, provide basis for professionalism. Professionalism should be maintained. Nurses are professionals, no? Yes, nurses are professionals, so professionalism should be maintained. Provide basis for professional accountability. Identify the role of nurse in changing society. Identify the role of nurse in changing society. Nurses should change the society. Their role is there, like providing health education to individual, family and community towards diseases, communicable diseases and hand hygiene. What are the food they should do, what are the nutrition, how they should survive. All these should be given to change the society. So here nurses play most role in changing the society by giving the and providing the health education. Okay, and discovering new measures for nursing practice. Discovering new measures, introducing new measures for nursing practice, and helping to take prompt decision making capacity should be there by administration to related problems. There should be enough decision making capacity. Nurses should be enough to take the decision according to the problems, and helping to improve standards in nursing education. Helping to improve standards in nursing education. We should improve the standards. and refining existing theories and discovering new theories. Refining existing means, refining means again then rewriting the existing theory, rewriting or molding, you can say molding the existing theory. What are the theories present or existing, remolding that and discovering new theories and giving to the future nurses. Okay, this is about the today's class. This is about today's class. If anyone have your doubts, you can comment it. Please like, share, follow. This is Ms. Vidya, nursing tutor. Thank you.